Transgender people who want to go on hormones sometimes worry about how it will affect their mental health diagnosis. I have even spoken with uninformed mental health professionals who worry about this and discourage their transgender clients from going on hormones because they don't know what will happen. Yet we don't think twice about putting someone on hormones when they have a mental health diagnosis and they are cisgender. So for some reason, there is this great worry about what cross-sex hormones will do to people, as though there is some disastrous outcome on the other side. I want to remind you that hormones that you will be putting in your body are not particularly foreign because your body makes them. They might be synthetic or what have you, but they're still not fully foreign. Regardless of how your gender may be assigned at your birth, you have androgens and estrogens in your body. Allow me to clarify what will likely happen with your mental health diagnosis if you are transgender and go on hormones. The symptoms of your mental health diagnosis, for the majority of people, tend to further stabilize. I have had clients with a variety of different diagnoses who went on hormones and did not have any troubles. These include psychosis disorders, mood disorders, depressive disorders, anxiety-based disorders, and all disorders on the autism spectrum. All of them felt better on hormones. In fact, they had their symptoms decrease and they stabilized. This makes sense because in the same way a cisgendered person with a hormonal problem would feel better on hormones, so does the transgender person. If you are concerned about your mental health diagnosis and how it will be affected if you go on hormones, then schedule an appointment with your psychiatrist within the first 7 days after you begin hormones, and then continue to maintain your regular appointments from there. Also, make sure your endocrinologist makes only minimal increases when you do have your hormones increased. This will give you time to see how you respond, and it will let you know you have someone there waiting in case you do have some sort of negative reaction to the hormones, however unlikely that might be. I want to be specific about this. I have had people who were diagnosed bipolar 1, bipolar 2, schizoaffective, generalized anxiety, panic disorder, major depression, dysthymia, Asperger's, autism, and ADHD. All did well with the hormones. Hormones tend to not have much improvement on personality disorders, but they do tend to stabilize other mental health disorders. Only one time did I ever hear of someone having a hard time when they went on hormones. This was on his increases. Because he had set up an appointment with his mental health professional that he was working with at the time, and the day after he had his increase, he had some sort of backup. If you are especially worried this could be you, I would suggest you try estrogen in pill form or testosterone in the gel form so that you can immediately stop hormones if it doesn't work for you. You just stop the very next day. If you have someone in your life who believes you should not go on hormones because of your mental health diagnosis, please send them this video so they can hear from me that it tends to go well. A mental health diagnosis does not need to stop you from going on hormones. It can actually be stabilizing. That is what I see most commonly, and it is rare to have anything other than stabilizing effects. If you found this video helpful, then please remember to like, share, subscribe, and if you can afford to do so, make a donation to my student loans, which exceed $100,000. Thank you.